And welcome back. And we're moving into our final conversation for today. And we're going to be talking about maternal and child health. And joining us for this conversation, we have Nurse Eufemia Waight, who's the coordinator for the immunization program from the Ministry of Health. And we also have technical advisor for the ministry, Dr. Natalia Bear. Good morning and welcome to the show.
Good morning. Thank you very much.
Now, whenever we start talking about maternal and child health, it's something that over the last couple of years, we've seen tremendous improvements in that area, and we look forward to good news. So, does that mean we have more good news coming?
Well, today what we wanted to do is to share some of the preventive services that we are providing. The Ministry of Health provides services at health facilities and during mobile clinics that carry the services as close as possible to those communities that do not have a health facility. And because we are speaking about maternal and child health, our target population is 88,000 women in reproductive age, 35,000 children from 0 to 59 months, below 5 years. And these services that we provide is to how can we improve both maternal health and reduce child mortality.
Why have we not seen also, because you're talking about your targeted populations in terms of the messages, why have we not seen an increase in terms of messaging to include men and the roles that they play as well?
Definitely, that is something that we need to improve on, is to include men, because especially in rural communities, they are the ones that have the say. And it is known that with higher educational levels, women have more decision than women without or lower educational levels. So we know that's an issue.
Yeah.
And it's not that men are not interested in being part of the solution for these problems, but we need definitely to involve them more.
Yeah.
And from early ages, including them in the interventions. So we have several issues that we're dealing with. For example, in 2011, we had a nutrition survey. Preliminary data results is showing that anemia is a problem. 20% of women in reproductive age, non-pregnant, had anemia. We have congenital malformations that we're still facing. Under nutrition, we have the issue of cervical cancer. So for these, we have, for example, the distribution of iron and folic acid and multivitamins for women in reproductive age. Before, we only used to give pregnant women, but we are extending it to before they get pregnant.
Okay.
We have
That's going to be done through the Ministry of Health?
It's being done.
It's being done, yeah. But how do women get access to these
They can
vitamins?
get it, if they are studying, we usually give it in schools.
Okay.
If they're not studying, then they can get it at health facilities or with their community health workers or during mobile clinic.
Now, here's the thing. If I am a young woman and
Which you are.
No, I know. If I'm a young woman who goes to the clinic to get folic acid, obviously the assumption is, oh, she's pregnant. But why is it important that there is, that you are able to supplement these vitamins in your system?
Well, iron folic acid help with the reduction or in all cases of neural tube defects. And the iron is for the prevention of anemia. And anemia can carry to hemorrhage after delivery.
Yeah.
And
so even if you're not going to have a baby at this time, it's good to be able to have it as a regular part of your supplements.
Yes. And women should feel free that every time they go to a health facility, to request the multivitamins and the iron and the folic acid because it's there available for them. And we have also the program of fortified food for children and for women that are undernourished that we are providing. And we have
fortified food?
In Caparina.
Okay. It's a shake?
It's a powder mix that they can use it in several forms, and it's packed with multivitamins too. Plus a small percentage of the daily intake of proteins and carbs.
So we're finding that the children don't have the nutrients and minerals that they need for their age?
Well, we have stunting, where about 19%, and in Toledo, for example, it's about 43%.
Let's talk about
Stunting?
stunting, yeah. What exactly is
So
that?
stunting, well, the issue is stunting is related to lack of access to quality food. On some occasions even to food. So
Meaning they're not at the right height based on their age.
yes, low height for age. So based on the different surveys that we have done in the country, we had the mix for 2006, and then we had the mix 2011. We had the height census in 1996, and then the next height census in 2009. And all of them are showing that we haven't been able to reduce significantly stunting. So the National Health Insurance, Ministry of Health, and other partners, we got together and decide, well, children cannot wait.
Yeah.
We have to intervene now. So that's why we introduced the Encaparina, which is a fortified food. And this is given to families with children that are undernourished or stunted.
So it's not, in some cases, it's that they're not getting enough food. But in some cases, they're eating, but their food isn't nutrient rich.
Exactly. Yes.
And the nutrients that are needed for the child to develop normally
Yes.
aren't there in their system.
Yeah.
So this fortified food will be able to supplement that.
Yes.
There's no cost?
No cost, and to the family, no cost, and accompanying with that is the education, but changing behavior is not easy. So there is cultural issues.
Some cultural issues.
Yeah.
Okay.
So evidence is there that a healthy mother will have a healthy pregnancy, and a healthy pregnancy will lead to a healthy newborn. So preconception care is something that we want to emphasize. And with preconception care, the first thing is individual responsibility. So it's encouraging men, women, couples to have their reproductive plan. But that is easy said, but not adequately done.
Making a decision to have
Making
a
a
family.
decision if you want to have kids or if you don't want to have kids, and what will you do? And the
So
amount
the health of the
children.
mother matters. Does the health of the father matter?
Both, but more directly is the health of the mother.
Okay.
Yeah, the health of the mother. And the next thing is preventive services. So couples should be reaching to us for us to help them identify what are the risk factors they have currently and what interventions we can do with them to have a healthy pregnancy and a healthy newborn. And these services we are offering also. And of course, we have contraceptive methods for adequate pregnancy spacing. So we have condoms, male and female. We have pills, injections, the coil, IUDs, and we have implants also. So these are provided free of cost.
Those are at the public health clinics?
Public health clinics.
Now, this is one of the issues I know that usually needs a bit of explanation because spacing of children is important for both the mother's health and for the child. Let's talk about that. What is the adequate amount of space? In other words, how much time should a woman ensure there is between having children?
What they're recommending currently is from 2 to 5 years. But below 2 years is a risk factor.
Why?
Because of the issue of, well, if you look at the kid, below 2 years is the most critical period. So if you are having children too often, then the care, the quality of the care that you can give to the first child will definitely be less with the increase in the number of kids in that age group. So, and the woman needs a time to recover from all these losses secondary to the pregnancy. So it is recommended 2 to 5 years.
Yeah. Now, go ahead.
Because it would take about 2 years for her to recover completely.
Yeah. Because the pregnancy itself, it takes a lot from the woman's body. So you need to get back to normal, I guess, the state of normal. Now, are we seeing better spacing? Are there any statistics? This has been an issue for quite some time. Are we seeing better spacing now?
The only data we have is the contraceptive use prevalence rate.
Okay.
And we were at 56 in 1999, 34 in 2006, and that's when the ministry decided to reintroduce the delivery of contraceptives. And in 2011, we went back up to 54, but it's still low compared to the other Caribbean countries. So it's a challenge for us to.
So family planning.
Family planning is a challenge, yes.
Yeah.
And we only cover about 8% of women.
8?
Well, we have 88,000 women. We don't have that amount of funds to cover all of those women. So we try to focus on women with reproductive risk factors or women with high-risk pregnancies.
Now let me ask the controversial question. At what age can a young woman come in to access services at the public health clinics that are provided for free?
Really controversial because you have on one hand the laws, and then on the other hand you have the mandate.
The statistics too.
The mandate to help men and women to access health services and protect their health. So by law, it is expected that girls below 18 years should reach with an adult. Ideally, in the ideal world, the parents.
Yeah.
Part of being a parent is to have that communication with young people, with adolescents, and to identify if there is no possibility of continuing to abstain from sex, then seek for information and for services. Now, the evidence show that only education will not work. It have to be the binomial of health education plus services. In this case, meaning access to contraceptive methods.
If I recall, the age of initiation, average age of initiation is 15, 16? Or 16, 17, yeah.
16, 17.
Which is below the age of 18.
Yeah.
Consent is 16, the legal consent.
Yes.
And for those 2 years that we know young people are starting to have sex and can legally consent to have sex, they cannot access the healthcare services that are available.
Yeah, definitely.
That is the challenge you're saying.
Yes, definitely. There are other surveys showing that even below 12 years, you have sexual activity ongoing, boys and girls. So it's a challenge, but unfortunately, who is paying the bill is the teenagers.
Well, I was going to tie in the teenage pregnancy rate or even some of the other STDs, STIs that we would see.
Yes. The teenage pregnancy rate is going down because the population is growing, but in absolute numbers, we haven't been able to reduce. And unfortunately, it hasn't increased, but 1,400, 1,500 adolescents are giving birth every year. So it's a challenge for us. We are working with UNFPA. We did a legal review of the barriers for adolescents to access sexual and reproductive health services. And this year we plan with the other stakeholders that we're working with to conduct district meetings and see if we can improve the access with or without parental consent. But that's a discussion that we need to have at district level with the population.
Now, when we're talking about maternal and child health in general, and I started off by talking about some of the positives. What are some of the things that we're doing right and that we need to improve on? You started talking about some of the supplements that were available to help bolster women and children. What other statistics do we have that indicate that we are doing well in this area and the upward trend needs to just be broadened?
Yeah. Well, we have zero infants with neonatal tetanus. That's zero for the past, over 15 years. And we have 0 cases of childhood diseases that can be prevented by a vaccine within the age group. So that is something that we are promoting and doing well in.
Let me jump in there because I know, and you are the coordinator for the immunization program. We have done very well with immunization rates in this country. However, I know you don't take anything for granted, and more with exposure that people have to other medias, some people start to buy into the anti-vaxxing population. How are we doing in terms of getting our babies immunized, and what do you think are some of the successes that we've had, or some of the things that we've done that account for the success?
The surveillance system and the mobile clinics providing that service, taking that service to the communities, finding that last child, which is what the nurses do well in the communities. We have community health nurses, about 70 of them serving the population throughout Belize, and they usually go the extra mile to find that last child to be vaccinated in the target population. And that's what has had our coverage 95% and over for the past 15 years, 20 years.
Have you found more people now refusing vaccinations?
There's still a few refusing, but we have that herd immunity in that the majority are vaccinating, so the small population that are not accepting the vaccine get protection through those.
Yeah. Okay. And the current immunization schedule, what all does it encompass?
Okay, so we have the from 0 day, which is when the child is born, up to we have the BCG, protection against tuberculosis. And then at 2 months, 2, 4, and 6 months, we provide them with anti-polio vaccine and the diphtheria, tetanus, pertussis, Haemophilus influenza type B, and the hepatitis B protection at those ages. 3 doses is what is required to be protected. And then we providing measles, mumps, and rubella vaccine when the child is 12 months, and we provide them with a booster at 2 years, but now has been changed to 18 months to better protect them at an earlier age.
You've also
and then the booster at 4 to 5 years, which is booster polio, and the diphtheria, tetanus, and pertussis, which is whooping cough.
Yeah. We also now include the flu shot as a regular part
of
vaccination.
At 6 months, and then up to 23 months, and other selected groups above that age.
And in terms of some of the disparities that we were seeing, because you were talking about stunting, for example, what kind of, especially in Toledo, being way above the national average. So we know that traditionally we see quite a disparity between Toledo and the other districts. What kinds of interventions, if any, are we seeing or are necessary to bring Toledo up to, the national average?
The data in Toledo suggests that there is a high rate of breastfeeding. But the problem is complementary feeding. After 6 months, we need to provide quality food to children. And sometimes, because of poor knowledge or poor practices or other social determinants, then the breastfeeding may continue exclusive. And then that is where you see the downtrend of the kids and being affected later on with stunting.
So they're not weaning the child from the breast.
So the breastfeeding is good for 1 year.
Breastfeeding is good up to 2 years, or whatever amount of years the mother want to breastfeed a child. But after 6 months, they need to add food.
Yeah, you have to add other foods for them.
Other foods beside the breast milk.
After that, we have the breastfeeding initiative. They're promoting exclusive breastfeeding. That's a program that is carried throughout the country, where promotion of exclusive breastfeeding is done in all hospitals and health centers.
So let's talk about one of the things that William was pointing out is obviously how important the numbers are. Maternal and child health are actually developmental indicators. In other words, people will know the quality of the country you're in. One of the indicators for that is based on how many mothers die during or after childbirth, and
Yeah.
how many children die right after they're born.
Yeah.
Where are we in terms of our statistics?
In regards to those two critical indicators that you well mentioned, that they reflect the developmental level of any country, we're not doing that good. Maternal mortality ratio, we were successful in 2 years to have zero maternal deaths, 2011 and 2013. And for 2015, and unfortunately concluding the MDGs, we had an increase. So we had 8 cases of maternal deaths. We had a cardiac patient. We had 4 of them related to sepsis, 2 hemorrhage, and 1 status epilepticus. So there were different factors surrounding each one of these cases. And for child mortality, we reduced from 2013 to 2014, we reduced 30%.
Okay.
So 2015, we had an increase, but not similar to 2013.
Well,
Still lower than
2013 is when we
2013.
had the neonatal deaths at PHMH,
Yes,
which
yes.
took up the number significantly. Now, obviously, and as the technical advisor, having gone from a place where, let's say, 3 or 4 years ago, we were in a very good, comfortable position with our indicators. What are you seeing, or what needs to be done to take us back to that place? Obviously, the loss of a mother after giving a child is a loss greater than just one life, but the contribution it makes to the child, and the loss of a child after birth. Yeah.
These are productive women.
So let's talk about what needs to be done to ensure that we can go back to the more comfortable statistics we were at.
Usually we consider the issues surrounding pregnancy for just the pregnancy itself, but every person come with a baggage. If I can refer to the World Health Organization definition of social determinants of health, where they say that these are circumstances in which we're born, we grow, we live, we work, and we age, and the systems in place to take care of their illnesses. But these are also shaped by economics, social policies, and even politics. So we would love to have zero maternal deaths every year. And we have some high indicators when you look at prenatal care, more than 95%, postnatal care increasing. Childbirth attendance, in some countries it's really high. For us, stillbirth attendance rate is 95%. But we come back to the preventive services.
Yeah.
If a woman have obesity, just obesity alone, with the increase of the level of obesity, the risk for congenital malformations is higher. So the ideal is the woman to lose weight before getting pregnant, but do we do that? No. Hypertension, diabetes, cardiac disease. I mean, it's not just getting pregnant and that's it. A good outcome. There is definitely a lot of work that needs to be done before the woman gets pregnant, if she have any of these chronic diseases. And then the issue of the other preventive services that we have, and we have to be, pleading to people to use the multivitamins, to accept the iron and folic acid. So it's a lot of, health is a social product.
Yeah.
And as you rightly said, maternal mortality is just showing that we have a lot to do as a country.
Yeah.
Because out of 88,000 women in reproductive age that you can target to prevent maternal deaths, it's only about 8% that get pregnant every year. So how do you address these 88,000 to reduce the deaths among 8% of them? So
and it's consistency as well that is necessary, because one year you can do well, but if you slack off, things may change.
We're a small country, so 1 year zero is beautiful, but next year you have an increase, and
All right. Any other information you'd like people to know about the preventative services available?
The next one is the cervical cancer. Yeah, so in 2014 we had 8,500 women, again out of 88,000. It's every 3 years coverage, so the message to women is every 3 years you should have a pap smear done.
Yeah.
We are moving towards visual inspection with acetic acid to see if we can increase the uptake of these screening services. So that is in the making, and we have a collaboration with Belize Cancer Society, private sector, and BFLA, trying to strengthen this.
Yeah, we had a conversation with them before. Essentially, that is detection and treatment on the spot, up to a certain point.
Yeah, we would have to make some modifications because we don't have the capacity to have detection and treatment, but at least detection and early referral. That is what we are seeking for the rural communities. For urban, we will definitely invest in the cryotherapy treatment. So we have a lot of challenges, but it cannot be the Ministry of Health alone. It is a social product, and it requires participation from all.
Right. So as you mentioned, any public health facility, which means your clinics and your community hospitals and mobiles.
Services are available there. So.
And that's folic acid for the anemia issue, the fortified food for undernutrition, and contraceptives and
deworming for children as well.
All right. Thank you very much for joining us, and we hope that it's the start of the year and women can just go in for a basic checkup and be able to access these services as well. Right? We're going to go ahead and take our final break, and when we come back, we'll have our wrap up, so stay tuned.